province of Ontario continues its fight against the COVID-19 crisis. And joining me now is our MPP, Jim McDonell. Welcome back, Jim.
Yeah, good afternoon.
All right, so Jim, we'll start with the health worker matching portal. This was launched yesterday, and maybe let's start about exactly what that program is and why it was decided by the government to start it.
Well, there's no question that this COVID-19 pandemic's put a strain on our healthcare system. We have a lot of hard-working employees out there, but we're asking them to work nonstop, and we just haven't got enough people to work 24 hours a day. So there's great opportunity. We know we have a great inventory of retired nurses, doctors, practitioners that are available and would like to work. So we're encouraging them. We also have a lot of international people that have come over in the last certainly the last decade, have skills. They've trained as doctors and nurses and have a lot to offer. And we need a way of matching the jobs of the employers to the skills they have. This is going to be, we're in for the long haul. We want to make sure that we get through this with this little disruption and, of course, the best results we can. And we just can't leave anybody in the sidelines that could help the cause.
And we know, obviously, that all of the measures for social distancing are aimed at alleviating some of that stress on hospitals. But it is nice to know that that preparations like this are being made to ensure that our hospitals are well staffed. Correct?
Yeah, and of course, as you go through something like this, you're going to have healthcare workers like the general population that are going to get sick. And for the good news is, for the vast majority of people that do get sick, it's 2 weeks, or a week at home with the flu, you might say, with a flu-type disease. But it's a time when you can't be out in the public, so we have to allow for that. Because it is a disease that of course has serious impacts on 20 or 15% of the population, and of course very serious on a smaller percentage that requires hospitalization. So we want to make sure that our facilities are there and we have the staff behind them without overstressing. People can only work these long hours so long before they get run down and they get more susceptible to this and other diseases.
And as of today, we've seen the program has been working very well. I believe it's around 8,000 people have signed up so far. But if people are interested in signing up for this portal, how can they do so?
Well, there's a website. It's it's onhealthworkforcematching.ca. And that'll get them to a website that in a efficiently and orderly manner allows them to sign up with their credentials. And then it'll, our area groups that are looking for people to fill positions can pick from that list.
And that number, 8,000, just goes to show how many people in our province are really coming together to combat this all together.
Yeah. Well, yeah, just even, my own family, you look at the numbers of health workers you have, many of them are retired. A lot of them look back and would like to help out. They understand that there is a serious issue coming up or is on us and will continue to be on us for some time, and knowing that their, former counterparts need some help.
And the Premier today was very adamant about our testing capacity in terms of COVID-19 tests, but we're not reaching it right now. I think the numbers are like 3,000 tests were done the other day, but our capacity is like 13,000. So I'll have your thoughts on that.
Well, we've been battling trying to get the test kits and then the reagent that has been short supply right around the world. So on the weekend, we secured enough of the two that allowed us to ramp up our testing. I understand on Sunday we got rid of the backlog. So really, it was an opportunity then to actually step up and do extra testing. And I think he mentioned a few areas, especially the medical health workers that need to be tested, especially in seniors' homes, and the general public that's that's experiencing symptoms, to let them know as well that they have it or not. So it's taking a few days to ramp up, and he's saying, we have the agents now, we fought for them, we got the components, so let's move on this, because it's been a real problem in the past not being able to get these components, and now that we have them, we want to take advantage of them.
And finally, MPP, we know on the weekend the list of essential businesses shrunk, but one more was added yesterday by the Premier, and we'll talk about the Easter Bunny.
Well, of course, we want to make sure all these essential positions are looked after. And is there anything more essential than the Easter Bunny coming up on the weekend with the treats he has to leave with all our young kids in the area? So I think that it was a very astute change to the essential workers list. So we look forward to having a great weekend, and I see today that stores and shops will be closed on the Friday and the Sunday coming up. So this is a chance for people, of course, to stay home with the family and enjoy the gifts of the Easter Bunny.
On that note, MPP, thank you so much for joining me for this update.
Yep, anytime.